Hello, I'm Craig Hummel, the Medical Director of PBH, which is a local management entity in Concord, North Carolina. I would like to spend a few minutes discussing our preventive health programs. Most managed care organizations have programs that prevent the emergence or worsening of health disorders. For example, if a patient has hypertension, the organization may periodically send out information about hypertension and the need to take medication. Also, the company may remind members over 50 to obtain screening for colorectal cancer. PBH has two such programs. These programs center on ADHD and depression. This is a short presentation to inform providers of these initiatives, as your patients may ask you about them. First, the depression program. For the last year, PBH has had a program that helps the patient monitor their response to treatment for depression. The STAR-D program has showed that only 40% of depressed patients treated with medication have a remission on the first trial. Also, it is established that patients not in full remission have a high chance of relapse. PBH sends to all newly diagnosed patients a DVD with information about depression and the importance of treatment and the achievement of remission. We also send them information in the form of a handout. We give them instructions on how to use the PHQ-9 to monitor their response to treatment. The PHQ-9 is a standardized tool that not only screens for depression, but also measures the outcome of treatment. The patient is directed to a website to complete the PHQ-9. It is automatically scored and patients are instructed on how to respond to the score. They are either informed that they are in remission or that they need to contact their provider for further evaluation. If they are suicidal, they are informed to contact our call center immediately. This has been done anonymously. This year, PBH is going to continue the program as I have just described, but also we are going to ask the patients if they want to participate in the program and allow us to track their response. This will allow PBH to follow the success of the program. Patients who choose to participate will be sent a PHQ-9 in the mail with a self-addressed envelope to return to PBH. The PHQ-9 will be scored and the patient informed of the result and informed to contact their provider if they are not in remission. Remission is defined as a PHQ-9 score of 4 or less. You then might be contacted by your patients asking about the results. We are asking that at that point you evaluate your patient. Remember, the PHQ-9 is only a tool and not the final decision maker on treatment. Treatment should be a clinical decision between the clinician and the patient. You may view the PHQ-9 on the PBH website, pbhsolutions.org. The second preventive health initiative focuses on ADHD. By following national guidelines, PBH believes that it is important to stress medication treatment and evaluation of comorbid conditions. Newly diagnosed patients with ADHD are sent a national handout about ADHD, telling them information about the illness and treatment options. They are then sent more material at 6 months and a year stressing these points. PBH will send out surveys with a questionnaire and a tool to evaluate the child's progress. Patients are informed to contact their provider if the child's symptoms don't improve. Once again, you can view the PBH website at pbhsolutions.org. In summary, PBH has two preventive health initiatives. Our goal is to maximize treatment for ADHD and depression. The purpose of this presentation was to make you aware of these and to understand why your patients may be contacting you about these programs. Thank you.